Good day, friends. I'm Dr. Sailesh Gupta, a senior practicing pediatrician in Malad and Goregaon. I've been around for last 28 years. Over the years, I have seen that the number of children coming in with respiratory problems such as respiratory infections as well as hyperreactive airway disease, which we call as asthma, has increased. So I can confidently say that, or confidently inform you that out of the 50 cases that I may see in a day, nearly 20 come with respiratory problems. So cough, fever, wheezing, breathlessness, difficulty in sleeping and so on. And it's quite distressing for the child and for the family. The children need to miss school, the condition does not settle down quickly, it takes 4, 5, 7 days to come around. So this is a huge disease burden that's weighing down our healthcare system, that's weighing down families, that's affecting children in a very unpleasant, in a very big way. Now, what is the reason for this increase in the number of respiratory conditions? I would put the first blame on increase in the environmental pollution. So the number of vehicles have increased over the years. We have more motor exhaust, the dust on the roads, there's more industry, there's more industrial effluents into the air, so there's a lot of sulfur, sulfur gases, a lot of nitrogen gases, carbon monoxide, carbon particles, soot. So all of that we inhale into our lungs whenever we breathe. And children breathe a lot. They breathe faster than adults, so the amount of air that they take in is more than what an adult takes in for every kilo of body weight. So you can imagine the amount of toxins, the amount of pollutants, the amount of irritants that's entering their lungs. And children's lungs are not fully developed until their teens. So all of these toxins get deposited in the lungs while it's developing, and then they remain there for a long time, producing chronic effects like asthma, repeated wheezy bronchitis, and so on. In addition, the pollutants in the air, especially the heavy metals, can also affect the central nervous system, can cause behavioral disturbances, cognitive disturbances, reduced intellectual abilities in children. So, pollution indoors as well as outdoors is a huge problem. Now, what do I mean by indoor pollution? By indoor pollution, I mean the house dust, the insects that die in it, the mites, the cockroaches, the other pests. And of course, the agarbattis that we use in the house, the dhoops, the smokers inside a house or even outside a house. Nicotine in the smoke, it kind of permeates the entire environment in the house, and even if it affects the child, what we call as passive smoking. And we all know the bad effects of nicotine on lungs. So, and some people in India still burn wood in their homes. So that causes smoke, that causes soot, and that's a huge indoor pollutant. Now, outdoor pollutants, I've already mentioned to you earlier, motor exhaust, gases, industrial effluents, and so on. So what does one do in the face of increasing environmental pollution? I think while the government does its job, we definitely maybe need to reduce the number of motor vehicles on the roads, and maybe we need to have more regulatory efforts for industrial effluents into the air. On an individual level, I think parents can try and reduce the indoor pollution by not burning incense sticks, by not burning mosquito coils, by avoiding, whenever possible, burning wood inside the house, by quitting smoking, by preventing passive smoking by the child. And if a child is allergic to dust, then it's prudent that when a house is being dusted, the child be sent out into another room, and instead of dusting, it's a good idea to swab the floors, take care of the house dust mites, take care of the cockroaches in the house. So kind of, indoors you can use these measures to prevent the child inhaling these pollutants. Outdoors, there's not much one can do, but you can definitely avoid getting out of the house during the peak hours of the traffic, maybe and avoiding smoky and dusty areas. And if your child is allergic, then if you're traveling out, it would be prudent to kind of tie a handkerchief around his nose and mouth so that he does not inhale the pollutants. The government is doing enough to reduce environmental pollution, but I think more needs to be done. And let us, on our part, the doctors, the parents, the children, try and reduce the indoor pollution so that over the next few years we can reduce the incidence of respiratory conditions in children, especially chronic respiratory conditions like asthma. So, hoping that our good thoughts will be translated into reality, and hoping that all of us will get recruited into working towards reducing environmental pollution and reducing the effects of this pollution on children. Thank you very much.